Hi, my name is Kim LeBlanc, and I'm an advanced practice nurse, clinical nurse specialist from Ottawa, Canada, and I'm also a nurse specialist in wound, ostomy, and continence. This is the Canadian version of the WOCN nurse for those of you from the United States. And previously in the episode, we talked about some of the challenges that healthcare professionals are facing now related to COVID-19 and wound care. Today, we want to switch focus a little bit and to talk about some of the barriers that we're facing, but as well, we want to look at some of the opportunities. So how can we remove some of these barriers, and how can we capitalize on some of these opportunities to improve patient care? Because certainly as clinicians, we're often faced with a lot of challenges, and we need to look at these challenges as opportunities. So if we look at our individual patients, some of the things we need to do is look at how can we emphasize self-care. So how can we look at this challenging situation, and how can we use it as a means to really improve upon self-care? And part of that we know is that patients need to have the resources, they need to have the support system, and they need to have the confidence to be able to provide that self-care. So we're provided now with an opportunity where patients are motivated now more than ever to provide self-care because they do not want to go to our acute care facilities or clinics because of fear of contracting the COVID-19. So we have on the flip side of them not being able to seek medical attention is that we have heavily motivated patients who want to participate in self-care. And some of the things that we can do is increasing that use of virtual platforms. So my clinics here had to all close down, and we moved to a virtual platform. So I've been doing virtual visits with my patients where we've been using platforms such as FaceTime and walking the patients through wound hygiene, basic wound bed preparation. And it's what we've been doing is actually really been empowering our patients. So I think that that's something that we can really take as a positive out of all of this, is that we are learning how to better motivate and to empower our patients to provide self-care. And to do so, what it does is it gives our patients back control as well. And many patients will tell us that that's one of the biggest issues that they have, is that loss of control. So I think that we can see that as one of the positives and something that we can actually take away from this and hopefully continue on with and make it sustainable. Some of the things, takeaway points we need to have is that we need to be working with our patients and community partners to make sure that we have a strong emphasis on wound bed preparation and wound hygiene. So, basically what we need to do is we need to be able to work in collaboration with our patients and their caregivers and our healthcare partners in the community to make sure they understand the importance of wound bed preparation. But we also need to make sure that we're simplifying it to a point that they can understand and that it's doable. So, often in my clinic, one of the first things that I'm going to do is do conservative sharp wound debridement. But we know that that's not going to be a possibility for someone to do safely by themselves in their home environment. So in that case, we need to be creative with the products that we use and how we use them to try and really promote that autolytic debridement and to make the patients understand that their wound healing may be slightly slower, but that we can still get the job done. We need to look to see, well, how can we do our full assessments virtually and manage moisture and to, do all these things that we need to do to have wound bed preparation. And we can take a lot of lessons learned from working in remote areas. So, in Canada, we are very geographically broad. There's a lot of, especially in our northern communities, we don't have the same healthcare services that we would have in our larger centers. And for years, we've been using virtual platforms for educating healthcare professionals in the North on how to manage chronic wounds. So we've taken a lot of those skills now and have brought them into the urban centers. So where we're working with the families and their caregivers, we're walking them through basic wound bed preparation. We're making sure that they're understanding how to do assessments to understand the key signs and symptoms of deterioration, of infection, problems with arterial perfusion per se. So just so they understand when they actually need to go and seek acute care help, so that we can look at how can we remove some of those barriers at the wound level so that the wound can go on for healing. And when do they need to actually go and seek further attention? And, treatments have one goal, and that's to, make sure that we're restoring that wound to a trajectory that it's going to heal itself. So I think this is where, we really play a huge role in knowing our products really well and understanding which products are going to be the safest and easiest for the patients to use in that home environment. So during this pandemic, many of us who are doing remote consults have really had to rethink how we're choosing our dressings and who's going to be applying the dressings. Previously, when I'd be seeing patients in my clinic, I could look at the wound and look to see what was the best dressing for that wound at that time. And I had good confidence in my colleagues in the community that we are going to make sure that we were able to use that product effectively and safely on the patients. Now I'm stuck with a slightly different scenario. I'm seeing the patient remotely. And as good as the video conferences are, it's not the same thing as seeing the patient live and seeing their wound and putting my hands on that wound to understand exactly what is happening. And I may or may not be dealing with a healthcare professional in the community. So I have to keep in mind that my assessment isn't as complete as I would like. And as well, I don't necessarily have the same control over who is providing care in the community. So I have to make sure that whatever dressing I'm choosing is going to be the best dressing for the patient and the wound at that time, but also is a dressing that will be easy for the patient to use, that will be safe for them to use, and that is not going to cause any deterioration for the wound. So, these are some of the things that we need to really keep in mind, and this adds a layer of complexity to managing some of these wounds. Especially if we're looking at making sure that we don't create skin tears or other medical adhesive related skin injury related to the dressings. So it's really important that we make sure that we pick dressings that are easy to use, that will provide what the wound needs in terms of moisture balance, that will protect the peri-wound skin as well. And my call to action to you is to think about all of the resources that we have out there to help us through this. And, frequently what I will do is I will call on the various industry partners that I work with to bring in their product specialists to help with the education around products. And I think that's something important for us to know. As a clinician, I know all the different products that are available to me in my workplace, but I'm not a product specialist. So often when I want to provide education sessions, I will bring in my industry partners to come in and to provide that ongoing education around their products, because they know those products better than anyone. And it's a great resource to have, and there's great educational videos that our industry partners have that we can also use with our patients and their caregivers. So I think it's really important that we look at the value that our industry partners do bring to us, and that we can work together collaboratively to provide better wound care.